Morning, everybody, and I'm really glad that we could all be here to look at the interesting, challenging work that we need to do on violence prevention. And I think one of the things is looking at us is how do we scale up our programs that we have very good information now that we can make a significant improvement with. But how do we also have the impact in countries that are most affected by the violence? And what we know, though, is that when it's not usually just one incidence of violence. It's violence that occurs over and over, and it's repetitive. And it becomes part of the environment. And what this exposure does to our societies, our communities, our families, our children in particular, is of great, great concern. And I think this morning what we have the opportunity to look at is to hear what this kind of exposure can and is doing, but also, more importantly, what we can do to relieve and treat this problem, and to hear it from very different perspectives and from different parts of the world. And what we're going to start off with is Tani Adams, and she has worked mainly in Central America and is going to be looking at that exposure and her experience, and looking at how we can put the pieces of the puzzle and the way forward together. And then we have Damian Hutchinson, who work with in Jamaica, and he's going to tell you about his community development approach to the work and the community-based work that we're doing. And also the whole Caribbean is in the epidemic of violence, and really needs to understand clearly some of the successes that we've been exposed to. And then we know that indigenous people are affected, are one of the vulnerable populations within this exposure to violence. And we have Carla General, who is here, who's going to tell us about her work with them. So I think we're really going to be listening. I really want you to think about the challenging questions, think about the questions of how do we scale up, how do we get the resources, and how do we effectively measure the impact of what we're doing. So I think at this point I'm going to ask Tani to go ahead and tell us all about her work.
Let me just see. Okay, I think I understand how to do this. Good morning. Thank you very much for inviting me. I enjoyed participating yesterday morning. I was sorry I couldn't be here in the afternoon, but it gave me a very good idea of a little bit of how you're approaching the problem of social norms, and I hope that what I'll present today will be helpful. I was really happy to hear Patrick Kelly yesterday start the intervention using the WHO definition of violence, because in my work on violence in the last 5 or 7 years, it's almost never referred to in the field of violence prevention, in the broader field of violence prevention among practitioners who we talk about. People who are thinking about citizen security don't remember often the physical roots of violence, physical and psychological, neurological roots. So this framework that I'm going to present to you, it's based on an analysis. I did a literature review starting with support from the Wilson Center and other sources, starting in about 2011, I did a literature review of what happens to people when we live in long-term violence. And I mapped that out eventually on Bronfenbrenner's systemic model, his ecological model of human development, which is what underlies the WHO definition of violence. And I think that it's a way of understanding the way that all the different violences that we're facing in the world today link to each other, and which is critical for interventions, because we're just blindsided, and we're going through an approach to dealing with gang violence, and for example in Central America, and we're not taking into account some of the fundamental drivers that are reproducing it. And it's a way, this systems framework that I'll present is also a way of understanding these new forms of violence which the World Bank detailed in its 2011 report, which confound these traditional notions of conflict and peace in conflict and violence and nonviolence. So, and I hope it'll show you how I think it provides us a way that we can contextualize and understand, identify the drivers that generate some of the social norms that become perverse social norms that are the things that we have to be working on. So we're applying this framework, as I'll just mention briefly. Jeremy, here in the back of the room, Jeremy Biddle from USAID. It's being applied in different places in Central America. USAID and the Honduran government I worked with them to apply this framework in the Honduran case, and it's informing now new programming that USAID is doing, and it's informing the way the Honduran government is characterizing, or it's framing its work for the Alliance for Prosperity. In Guatemala, I used it to inform the way the approach to the conflict assessment of work in the Western Highlands, for those of you from AID who know about the conflict assessment framework, which is another interesting systemic framework. And now the United Nations Economic Commission for Latin America is supporting the work to analyze how chronic violence affects development in both Guatemala and El Salvador, with the support of the Salvadoran government as well. So, and there's NGOs working out of the health sector and health and psychosocial support sector in Guatemala that are beginning to play with this concept. So let me just run through it relatively briefly. It's complex, and there's material that I can give you, this written stuff, the stuff that's written on it, so I can. So the way we're talking about chronic violence here is that, here I have this I can look at. According to the WDR, the World Bank, we're talking about at least a quarter of the world's population that is going to be living in conditions of long-term violence. That's neither peace nor war. In countries, it happens often in countries where there's long-term state incapacity, state fragility, or state absence, and among people who are unable to fundamentally change their conditions of life. Central America, South America, particularly the Northern Triangle of Central America, is a major arena where this is occurring, but it's also occurring in parts of the Middle East and Northern Africa, Sub-Saharan Africa, and among urban populations all over the world in urban marginal settlements. So, for example, Sue Popkin at the Urban Institute is using this to inform her work around sexually coercive environments in Washington, D.C., a mile from here, Chicago, right, Baltimore, and among marginalized people worldwide. So we're talking about people who are living in these long-term conditions where the state just is not able to really function in a constructive way. As I already mentioned, we're using the systemic framework for systemic definition of violence that the WHO came up with. And by chronic violence, what we mean is, this was a definition that Jenny Pierce came up with from the University of Bradford in the UK, where rates of violent death are at least double the average World Bank for the World Bank income category, where levels are sustained at least over 5 years. It's a definition that tries to create a parallel to the definitions for chronic malnutrition and chronic poverty to give us something quantitative where we can begin to look at it. And where acts of violence occur in multiple social spaces. So that begins to account for how it becomes self-reproductive. So if we look at Bronfenbrenner's diagram, just for those of you who don't know it, we're talking about from the microsystem where the maternal or paternal infant bond exists. We move out to family connections, community connections, national, international. And what's interesting, I think most valuable, I guess as an anthropologist, I appreciate this about Bronfenbrenner's diagram, is that in this framework, we're talking about institutions, relationships, but also the ideas that we have about them. So perceptions and the institutions themselves are contemplated. And this is critical because, as we know from the violence literature, often it's the perceptions that are driving things more than the reality, right? So chronic violence, and I'll just summarize kind of what the propositions are and then explain briefly kind of how this changes, how this paradigm shifts the way we would approach violence challenges. The way that we talk about chronic violence is driven both by macro level processes, everything from dynamics of urbanization, the collapse of rural development policies, globalization policy, the way the media works, failed democratization, or this sort of this reality of insufficient governance that becomes a chronic reality. It's like we're not, so many governments that we think about as democratizing aren't on the road to anywhere. They are, as Thomas Carruthers says, that they are what they are, right? And we have to understand how governance occurs rather than think, oh, this is a government that just hasn't gotten to democracy yet. So it's driven both by these macro level processes, and these are detailed in the papers I've written, and by micro level dynamics, which is what I was able to map out through the literature review. And if we look, so the first thing that happens is that exposure to chronic violence weakens the capacity of individuals and families to develop in healthy ways. Physically, neurologically to begin with, right? Physically, mentally, and socially. So one of the first things that begins to break down is the maternal-infant bond. I mean, when mothers are under chronic stress of fear and uncertainty, often through the dynamics of traumatization, the capacity to have empathy towards the child is hindered. So this is a major breakdown, as we all know from Head Start from years ago, from what Bronfenbrenner's work was in the 1970s, but it hasn't been applied often in the violence prevention field. And then when you look at what happens, what are the consistent patterns in social relations, we see the capacity of people to develop and maintain constructive social relations is compromised. So scapegoating becomes a very consistent pattern of we can call it xenophobias or scapegoating. And there's a recent report from the Institute of Justice and Social Reconciliation from South Africa, for example, that on approaches to trauma that lists scapegoating among one of the classic collective responses to traumatization when we're talking about collective traumatization. So scapegoating it's on the map as something that is an effective trauma. And we see in Guatemala, for example, lynching, I think, can be, which was a major, major problem in Guatemala, a little bit less now, but it's something that we can understand it better if we understand this as an effect of collective traumatization, as opposed to just simply because it's something people learned how to do in the war. I think it helps us get a richer understanding. Scapegoating, social silence, segregation from other people, blocking off people, the inability to move in spaces so that you're more and more isolated. And then it compromises the capacity of people to develop a sense of civic responsibility and civic action, because when we're in this constant fight or flight reactive mode, we're not thinking about how we can help other people. We're thinking about how I can get from here to there safely. And so in that constantly reactive fight or flight space, what you can do is you can think tactically, but you can't think strategically or collectively in terms of long-term strategies to solve complex problems. And for folks that are living in the long-term absence of a constructive state, we need to be able to think constructively and strategically. So consciousness is maybe a more wooey way of thinking about it, but consciousness is what we need to be able to engender in these scenarios. So when people are thinking of themselves as victims, and this comes up over and over and over again, and part of, unfortunately, the human rights discourse inadvertently pushes people to think of themselves as victims. I have rights. We're all taught now, and everyone around the world through international aid programs is taught to think we have these rights and those rights, and we should be able to push for these rights. But people in scenarios where states don't function don't have rights. Rights are ephemeral, right? So if you think about citizenship, citizenship is composed of the combination of rights and responsibilities, but responsibility comes first, because if you don't have responsibility, you can't create rights. So in these scenarios, responsibility becomes a primary priority in order to be able to create conditions where people can actually have rights. So in conclusion, chronic violence is a systemic, self-reproducing, and long-term normality that generates perverse social norms among a growing number of people. So you can think, if we move on, if we look at here, so what does human development look like in context of chronic violence? First of all, we have to contemplate the impacts of trauma throughout the system, not just one event trauma, but chronic traumatization. And this is something we know more and more now about collective traumatization. That literature is developing. But what it means to treat people who are chronically being traumatized, so that if you work with them 1 week, you still have to work with them the next week and the next week and the next week. That we don't know how to do yet. We don't have strategies or even a language for talking about chronic traumatization. I'll be fine in 5 minutes. So we have to think about traumatization occurring throughout the system, including among national leaders, right? And that new report from South Africa talks about the effects of leadership that's traumatized, and that's post-war scenarios. We're seeing it often in Central America. It's been very clear. And we talk about, you can't see it, I guess, on the screen, but in these scenarios, all of you, for those of you who may know Primo Levi's work, he talks about in the gray zone, where in conditions of these kinds of conditions, the difference between moral and immoral, legal, illegal, licit, illicit blur. So we have a blurring of the boundaries between licit and illicit. This is reality. This is the reality in which people live. It's a different way also of thinking about corruption. So if we have to understand it as a complex problem, it's not a linear issue. It has to be dealt with. There's no linear, predictable relationship between cause and effect when we're thinking that, which has a lot of implications for programming, which unfortunately still continues to be mainly linearly context framed. And then just go through briefly the ways that this shifts our view. We move from violence as a diverse array of discrete problems to understanding it as a systemic phenomenon with multiple causes and effects. So you can attack violence in any context, but you need to understand it linked to other kinds of violence. We move from isolated, siloed approaches to holistic strategies that are intersectorial, interdisciplinary, and relational. And the ideal would be to move from the goal being violence reduction or strengthening human development. We want to move from violence reduction or violence prevention to a broader, more comprehensive goal, which is how do we strengthen human development even in these perverse scenarios, which includes human security but goes beyond human security. This focus that we've had over these last years on human security doesn't go as far as we would like when we think about human beings deserve. Human development, I think, is much more robust, and it was lost in the shuffle in these last 10 years of development dialogues. So, because that talks about how we enable people to thrive in all the dimensions of their humanity, which what people need to be able to do in order to confront these long-term perverse scenarios. And then violence reduction in that context becomes a strategic indicator for change with very clear ways of measuring it. We move from a top-down state focused on security to a bottom-up, not to also include a bottom-up. We need to work from top-down, bottom-up, side-in. We need to move from every angle on this, but we really need to include this bottom-up focus on how violence is actually experienced in the flesh by the human beings who live it, for whom multiple kinds of violence are hitting them at the same time, and their human experience isn't just affected by gender violence or state violence or gang violence. They're living the entire package, and that's where we have to start in terms of interventions. So from looking at specific kinds of violence to the specific vulnerable groups that are experiencing violence, we can develop a much more nuanced approach. Finally, since it's a complex problem, as I mentioned before, we have to shift from this linear cause and effect approach to long-term efforts that that are necessary to deal with complex problems. So it means that we have to focus more on implications for programming. We have to focus more on primary development, families, primary networks. How do we strengthen those to develop constructive resilience? How do you enhance the capacity of communities and micro-level groups to thrive in these perverse conditions? And there's lots of ways to do it, even assuming long-term absence of the state, right? But that means we have to think about strategies that really are sustainable without external support, which is always the bugaboo for any kind of programming. We have to incorporate effective approaches to collective and chronic traumatization, much more than the individual one-event concepts of traumatization. We have to emphasize responsibility over rights, give ongoing support to people who are working with traumatized victims, and that means the international aid actors. They also need work on the trauma front. And at the macrostructural level, there are sometimes opportunities to work. I mean, when we think about how we deal with the effects of globalization, urbanization, derailed democratization processes, how do we work on those? There are opportunities. In any state, what we need to start doing is mapping what are all the conditions that are generating violence in a particular scenario, in a particular country or region or among a particular group. And then you look for the strategic opportunities. Where are they at any particular moment? So you can intervene at any point in the ecological system, taking into account with the 360-degree perspective what other things you need to be thinking about as you move forward. And finally, so operationally, this requires systems-based analysis and approach. It requires place and group-based foundational research, is really mapping out all the drivers. This is what I'm doing right now for UN-ECLAC, for both Salvador and Guatemala, is creating these preliminary mappings, and we also did it for the Western Highlands in Guatemala. I did it for Honduras a few years ago, but this can be done participatorily at the community level. And then you have that kind of mapping, you begin to create strategies from a much broader understanding. And I'm finishing now. And then I think what's fundamental, and this is why we're developing this international learning program out of School for Conflict Analysis and Resolution, we need to create spaces for long-term collaborative, cross-sectoral, interdisciplinary learning, because we're groping in the dark. No one knows, and it always requires us to understand more about what's happening elsewhere than what we can handle through our own siloed approaches. So that's kind of what we've been doing in Central America, where it's also under discussion now I'd be very interested in talking to you, Carla, because I think, for example, folks on Indian reservations are among the prime vulnerable groups in this country, but so are people living in urban settlements here, and the Muslim kids that are living in Paris, and it's all over the country, all over our country, and all over almost every higher income country in the world as well as the countries that we tend to think of as aid recipients. So thanks very much, and appreciate being here.